The important take-home message about essential fatty acids such as omega-3 and 6 is that we need them for life, but we need to be very careful of where we get them from, as quality is extremely important. The benefits of omegas is vast. One way they impact cardiovascular health is enabling our arteries to remain flexible. In the next section, you'll hear just how critical flexible arteries are.
Well, plaque is definitely a problem. The way I look at it is two simple concepts. One is trauma. You could predominantly, that's barrel trauma. Atherosclerosis never occurs in veins unless a vein is used as a graft and put under pressure. Then it gets it. Small arteries don't get blocked off. It's the big ones that get the bulk of the pounding. If you want to look at it visually, if you cupped your hand, and this is the inside of an artery, and you took a big soup spoon and you just tapped it on there every time your heart beat, well, pretty soon, this over time, and atherosclerosis is a disease of aging, you're going to start getting a callus or a thickening or calcification or some irregularity to an otherwise perfectly smooth surface. Now, here's where hypertension comes in. Hypertension is hitting your hand harder. If you're not going to tolerate it as long. If you hit that spoon on there pretty hard, you're going to cause damage to that artery faster. The third factor, so there's time, there's how hard you're hitting it. The third super important one is how flexible that artery is, how distensible is it. This is where the omega-3, omega-6 ratio is super important.
So arterial flexibility or arterial elasticity, arterial stiffness, all these are very important terms. You want your arteries to be elastic and flexible, like a brand new garden hose, not one that's been sitting outside all summer and becomes hard and cracks. A flexible artery, so when the heart contracts, all that blood that's pumped in there is going to cause the blood pressure to go up, unless your arteries can expand to accept the flow. So that flexibility keeps the blood pressure controlled and reduces arterial damage and reduces rupture. If your arteries are stiff and that flow comes in, arteries don't expand, the pressure goes through the roof, 250 over 120, patient has a stroke or heart attack, or worst case, the artery ruptures like an aneurysm and you have sudden death. So arterial elasticity is very important. Keep those arteries nice and elastic, up and down, up and down. And there's a lot of things that we do to keep them elastic.
Arterial flexibility is paramount to cardiovascular health, and that's the 120 over 80. So the heart goes boom, and you get a negative pressure of 40. That's 120 minus 40 is the 80. That's where that comes from. So you need a very flexible artery. Otherwise, it will crack. If I take a straw and I just squash it, it is going to break. That's what happens on the intima of the artery. Remember, there's 10 layers in there. You got 10 chances that there's going to be a crack somewhere, and hyperplasia happens, which is the repair mechanism trying to fix it, and you will get occlusions, you will get cholesterol trying to repair it, you will get all kinds of things and big, big problems. So arterial flexibility is critical for cardiovascular health. The parent essential oils actually make the structure of the artery. So that's where the flexibility comes from, as long as they're fully functional.
And then there's a lot of supplements that improve arterial elasticity. For example, we have a beetroot extract. It's called Neo40, which raises nitric oxide levels in the arterial wall. And that will actually improve arterial elasticity. We've done clinical trials with that here in the Institute, and it works very nicely. You can eat a lot of spinach, a lot of kale, a lot of beets. That'll get your nitric oxide levels up as well. And then there's other supplements like coenzyme Q10 improve. If you get your arterioles elastic, stroke risk goes down, heart attack risk goes down, claudication, which is a problem with leg pressures, gets improved. Literally, arterial elasticity reduces risk for all cardiovascular complications. And to give you an example, as you get older, your arteries are going to get stiff. It's hard to get around it. And what you'll see in someone who's like 85 or 90 years old, their blood pressure, their top number is really high, systolic, like 160, 180. Bottom number is really low, 60. That difference in the two is called pulse pressure. So a high pulse pressure, high systolic, low diastolic is classic for stiff arteries.
So the worst thing you can do is to eat lots of processed foods containing those rancid oxidized oils.